It's Monday. The president has remained without fever since Friday morning and his vital signs are all stable. The medical team gave an update on his condition earlier on this evening.
Thursday night into Friday morning when I left the bedside, the president was doing well, with only mild symptoms, and his oxygen was in the high 90s. Late Friday morning when I returned to the bedside, the president had a high fever and his oxygen saturation was transiently dipping below 94%. Given these two developments, I was concerned for possible rapid progression of the illness. I recommended the president we try some supplemental oxygen, see how he'd respond. He was fairly adamant that he didn't need it. He was not short of breath. He was tired, had the fever, and that was about it. And after about a minute, on only 2 liters, his saturation levels were back over 95%. Stayed on that for about an hour, maybe, and it was off and gone. Later that day, by the time the team here was at the bedside, the president had been up out of bed, moving about the residence with only mild symptoms. Despite this, everyone agreed the best course of action was to move to Walter Reed for a more thorough evaluation and monitoring.
Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile. And if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course.
Our correspondent in New York, Sherwin Bryce Pease, joins us now to talk a little bit more about this. Sherwin, so we see there the presidential medical team talking about his condition. Sean Conley, the lead doctor, providing what he calls an upbeat assessment of the president's condition. What is interesting about this is that he also chooses this conference to go back to what happened in the past 24 hours or so, referring to what the White House Chief of Staff said, and says it was not a contradiction. It was rather a misunderstanding, misconstruing of the two statements. So take us through this. So what did we actually learn from this?
Well, we're learning to approach what comes out of the White House, including the president's medical team, with a healthy dose of skepticism. There's, as you correctly point out, the misspeaking from the White House physician, that statement from Trump's chief of staff, Mark Meadows. And while they continue to give this very rosy assessment, we also understand that they are throwing the kitchen sink at the president's condition in terms of the medication that they are administering. It's a piece of very powerful drugs that received emergency approval from the FDA in May. Remdesivir is this antiviral therapy that he continues to be receiving, this 5-day regimen, which we know reduces the length of hospital stays associated with coronavirus. They've also now told us that they're giving the president a steroid, dexamethasone, which improves pulmonary functions. The World Health Organization recommends this steroid drug for severe and critical COVID cases. We also then discover from Dr. Conley today that they did, in fact, administer supplemental oxygen to the president. You heard him speak in that clip about how the president's levels dropped below 95% on Friday, and then again on Saturday below 93%. And of course, yesterday, this was a question put to him by that press gaggle outside Walter Reed, and he denied. He was sort of equivocating about what they'd done in terms of oxygen. He didn't give a clear answer. He explains today that they were trying to reflect an upbeat attitude of the medical team and not steer the course of the illness in another direction. He didn't want to rattle the president. So what we're getting, certainly from the communications team here at the White House and from the medical team, is really trying hard to put out a positive narrative regarding the president's health, no less from the president himself, who released this video last night from Walter Reed. Here's some of that.
And as you say, Sherwin, we saw a lot of confusion after that first briefing, and of course what came out as an anonymous source saying that things are not necessarily well. Today we're getting some sort of clarity in hearing what they call a transient what do they call it, oxygen assessment or rather, what do we call transfusion, whatever they called it, and it's quite interesting to hear that they're giving detail but not giving detail. So they're talking about the treatment, but not really talking too much about the oxygen dips, as they called it.
Yes, I mean, they really are trying to put out a positive trajectory here in terms of the president's recovery. You hear from the doctors that, his lung, they're not being very specific about his lung condition, but they talk about his vital signs that are stable. They've checked his heart, they've checked his liver, they've checked his kidneys. Those are all stable. They talk about him walking around the White House, the Walter Reed precinct, the presidential suite. So very much really trying to put a positive spin that the president is still at the wheel here running things. In fact, we also heard from his national security advisor, Robert O'Brien. He spoke to reporters at the White House. Let's listen to what he had to say, Tsepiso.
I haven't talked to him yet this morning. I spoke with the chief of staff before coming to the White House this morning. He said the president's doing very well and not surprisingly wants to come back home. So he's been watching TV, he's been working, and he wants to get back to doing the business of the American people. I'll be briefing him this afternoon along with General Milley and Secretary Pompeo. We're scheduled to give him a foreign policy and national security brief. We'll be here at the White House. He'll be at Walter Reed in a secure facility, so we'll be able to brief him this afternoon.
A man that is still in charge is getting national security briefings today. And of course, in terms of that confusion, when we got that rosy assessment from those doctors yesterday at Tsepiso, right after that a press conference with the media, Mark Meadows, the president's chief of staff, then called media aside and spoke on background and told him that the president's vitals over the last 24 hours were very concerning and that the next 48 hours would be critical in terms of his care. So you had one message from the medical team and the chief of staff standing alongside them when they were delivering that rosy assessment, and then immediately afterwards calling the media aside and giving a completely different assessment. We don't understand why that would be, why this he felt this was important. Did it have the president's approval? So a lot of questions as to how they are communicating around the president's condition today.
All right, so showing that term that I was looking for, because I kept on oxygen saturation, because they kept on using it so often. So we continue to learn now about the new COVID-19 infections associated with this outbreak in the White House. We spoke about the list of people that could be traced and who could possibly be COVID-19 positive. We've learned that Mike Pence, the vice president, and his wife have tested negative. What else are we hearing?
It's like a leaking tap, Tsepiso, drip, drip, drip. Every day, new people are added to the list. Essentially, everyone or anyone that came into close proximity to the White House over the last number of weeks, close proximity to the president. Today, we are hearing that an assistant aide to the president, what they call the president's body man, he goes wherever the president goes. Nicholas Luna has now tested positive for COVID-19. Of course, yesterday we reported that Chris Christie, the former governor of New Jersey, who had been helping President Trump with his debate prep ahead of that presidential debate on Tuesday in Cleveland, Ohio, he tested positive and has admitted himself to hospital because he suffers from asthma, which is a huge underlying condition. He also has weight issues. So he said he drove himself to the hospital. He was feeling fine, but through an abundance of caution has now admitted himself to hospital. And we expect to hear more confirmations in terms of positive diagnoses for people that are at the White House, work at the White House, who certainly came into close proximity with the staff working there, Tsepiso.
And another revelation showing the Republican Senator Ron Johnson of Wisconsin also testing positive for coronavirus after being exposed to someone apparently with the virus earlier this week, making him the third GOP senator to test positive in 24 hours. So is this going to threaten the quick confirmation prospects of Judge Amy Coney Barrett, because there's supposed to be Supreme Court hearings?
The short answer is no. We understand that those three senators, including Tom Tillis from North Carolina and Mike Lee from Utah, in addition to Ron Johnson of Wisconsin, they are self-quarantining. They're working from home, but they're not showing severe symptoms. And we understand from Mitch McConnell, given how important Republicans are viewing the confirmation of Amy Coney Barrett to replace Ruth Bader Ginsburg, that this speeded up trajectory in terms of her confirmation will go ahead as scheduled, and that will begin on October 12th. So despite what happens here with the president, the indications from Senate Republicans is that they are going to move ahead with her confirmation as swiftly as possible, hoping to get her confirmed before Election Day. And the good thing is it appears we are going to have an election. So the president's going to be discharged tomorrow.
And I'm sure we'll talk to you about that tomorrow. Thanks a lot, Sherwin, our correspondent in New York, Sherwin Bryce Pease, on the latest coming out of the U.S. The condition of the first world's leader, his doctors giving a positive report back on his condition, saying that he may have had 2 incidents of concern with regards to his oxygen saturation, as they called it, but that it seems that is all go for his recovery. Back here at home, South Africans have shown mixed feelings to the news of the U.S. President Donald Trump's testing positive for the coronavirus and being hospitalized. Let's take a listen to some of those.
Doesn't mean if it comes from China, it's China's fault that everybody in the world has corona. It's also his fault that he has it because he didn't wear his mask. We should set an example actually for everybody, even on TV.
Shortly, I'm saying that Donald Trump was just taken over by his feelings that they have that trade war and what in China. So simply he was just trying to point the finger in China.
Donald Trump got what he deserved in a way, because he was always joking around about this whole situation of corona. He wasn't wearing masks, making fun of other people. And in the end, I think he got what he deserved.
I am not surprised at all because of the way that he was. While we were busy saying COVID-19, he was saying the disease from China. While we were busy protecting ourselves and he didn't want to wear the mask.
As a youngster, I think that Donald Trump should have been a better leader in the time of COVID, because his example of not wearing a mask made the rest of America not wear a mask and just go out in public in groups, and that really made the case in the USA very hard. And now that he has corona, just made it a lot worse.
As the head of state, you would expect that he would be the last one to get infected by this coronavirus. And given the fact that he's known about this virus and how it spreads for quite some time now, there's reports that he's known about this since January already. So it's unfortunate that he now has gotten infected by this virus.